It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. Awaiting my computer to wake up here today. So while we are waiting for that to happen, we'll tell you that AccuWeather says we're for a stretch of great weather. Sunny skies today, tomorrow, Saturday as well. Partly cloudy on Sunday, a chance of some rain, but then the sunshine returns for Monday, actually all the way through Thursday of next week. So some really good weather is coming up for us, and we're looking forward to it. As we get rolling here with Dr. Amit Ladani. We're going to go ahead, and since we're having a problem with the computer this morning, we'll talk with the doc and we'll fix up the audio a little bit later. How are you?
Great. How are you?
Wonderful. It's good to have you back with us. Our conversation is brought to you by Marcus & Mack, voted best personal injury law firm, the best of Indiana County contest. Marcus & Mack, a law firm representing injured people. So you're saying it was all the way back in 2015 when we first met?
I believe so, 2015, 2016.
Wow. And you are back at IRMC and just in the last couple of months.
Yes, I started here on 1st of July, 2023.
Wow. And so you were in Morgantown, West Virginia for a good time?
Yes, almost 4.5 years.
Yeah. Well, it's good to have you back with us now.
Thank you.
As we talk about rheumatism, and you're a rheumatologist, and it's probably a good idea just to start with what that is, because, we have maybe popular or unpopular images of what rheumatism is, but there are a lot of people who suffer from it, aren't there?
That's correct. I guess there is a bit of a misconception about what we do and what we treat, but basically a rheumatologist is an internist or a pediatrician who is trained for a few more years to specialize in dealing with musculoskeletal disorders and autoimmune rheumatic diseases. We call it rheumatic diseases, that deals with joints, bones, and muscles. So whereas the orthopedics, replace and do surgery on the joints, we try to diagnose things medically and treat it with medications.
Mm-hmm. Rheumatoid arthritis is something that we might think affects older folks, and it does, but it also is very prevalent in younger folks too, isn't it?
That's correct. It can even start out in kids. We call it juvenile idiopathic arthritis. It used to be called juvenile rheumatoid arthritis. So it can affect kids as early as 2 to 3 years of age, and it can start in the 6th or 7th decade. So it can affect an individual in their prime time.
And it can be very debilitating.
It can be. In some cases, it can really potentially be a life-changing thing. It can affect your joints to an extent. It can destroy it, and you are unable to grip things, open a doorknob, or pick up a fork, and it can be a life-changing thing.
Yeah, and but at the same time, it's something that can be controlled, and that's where you come in.
Definitely. In the last 20 to 30 years, we have made remarkable progress in terms of pharmacological treatment aspect, and there are potentially numerous medications available now to sort of stop the progression. So we cannot say we can cure it, but we can definitely get it under remission so that a person can have a long, productive life.
I want to talk with you about the symptoms and how people who don't know they have it might be experiencing it, and we want to get into that. But I also wanted to talk about gout, because gout is something that you deal with as well.
Yes, that's correct. Gout is a form of crystalline arthropathy. So it sort of has a crystal that goes into your joint and causes intense inflammation and pain and swelling.
Mm-hmm. Mm-hmm. How does that relate to what you do?
Since it causes predominantly arthritis, that's where we come in, and we have medications to sort of treat and get things under control. In fact, gout is one of the most treatable conditions we have.
Oh, yeah. So I want to stay on that topic for a second, because I hear about it all the time, that somebody is suffering from gout, and they always talk about how painful it is. And my brother just went through it. It is extremely painful. What are the causes of gout beyond what you just said? Are there things that we do that eventually can cause gout? Are there dietary concerns? What are the things that really make gout such a problem?
So in in broad terms, gout is merely a condition where you have a higher level of uric acid in your blood. So when it goes beyond a certain point, it tends to precipitate and go into your joints and cause intense inflammation, pain, swelling, which you see as a swollen, red, painful joint. You cannot walk, you cannot even touch it. So you're right, it's extremely painful. There are certain genetic conditions that causes gout. So if you are predisposed to have a higher level of uric acid, you do. But on top of that, obesity, poor dietary control on things that has high purine content like red meat or seafood or alcohol, that increases your uric acid even further. But that plays a little bit of role. More of it is more like a genetic component. So if you are destined to get it, you'll get it. But if you have a good dietary control, you might not have as much flare-ups as you do. And then there's a small proportion of patients who get gout in their early 20s, and it's purely a genetic condition.
Wow. Okay. Well, we know that there are some very painful conditions, and you deal with a lot of people who come to you probably in a lot of pain. And obviously, this is something that they need to get taken care of and need to work on. And it becomes more than just a one-time thing, more than let's get over this bout of gout or bout of arthritis or something like that. It really changes a life, doesn't it?
Definitely. I mean, besides having that painful episode for 5 to 7 days, if you just treat it and let it go and don't think about the long-term consequences and don't get your uric acid under control, it tends to further keep happening more frequently and at more and more joints, and ultimately, if uncorrected or untreated, it can cause joint destruction.
When we have pains in our bodies, and sometimes severe pains such as you've been describing this morning, we might not think of rheumatism as being at the root of it all. For folks who are suffering unexplained pain, or folks who have some sort of condition that has been long-term for them and they really have never gotten it diagnosed, what might be the signs that it has to do with the rheumatism?
If we talk about things like autoimmune rheumatic diseases or inflammatory arthritis like rheumatoid arthritis, usually patients would present with joint pain and stiffness, morning stiffness that lasts for several hours. And this is not related to whatever they did the day before. We all have had a very physically demanding day sometimes when we hike or when we do certain things when we are not doing, and we feel soreness and pain the next day or day after. That's very different from the kind of pain the patients feel with rheumatism or inflammatory arthritis, is that every morning when they get up, it's hard for them to move for hours and hours together. So they only somewhat get better by noontime. So this is typically a first or predominant symptom of what we call inflammatory arthritis or rheumatoid arthritis.
So folks would automatically come and see you, or would they need to be referred to you? How is it that they come to visit with you?
Well, I think it's either way. They should usually see their primary care doctor first and then come to see us. But sometimes if for whatever lack of access or lack of ability to get in, they can sometimes make a direct appointment to come and see us.
Yeah, I would guess that probably they're not sitting around and they have this unexplained pain and they say, I know, I need to go see a rheumatologist. They would probably start that road with their primary care physician. That makes sense, doesn't it?
Most do, but sometimes when they are in the middle of switching primary care or unable to get into see somebody when they've moved towns, they sometimes come and see us directly, and that's fine too.
Are the treatments that you're able to provide for them medicinal for the most part, or what are some of the treatment courses and protocols that you use?
So medicine forms an important part of what we do, but also equally important is physical therapy, having a healthy lifestyle, having a good support, community support, emotional support, and family support. So yes, medicine forms the cornerstone and is a large part of what we do, but the other aspects of person's holistic well-being cannot be ignored.
Dr. Amit Ladani is our guest this morning. Back at IRMC, you're operating out of where? Where are you located?
I am primarily located at Blairsville.
At IRMC at Chestnut Ridge?
Yes.
You've got your own office there?
Yes.
And I'm sure that you since you've been back of these few months that you've certainly got your schedule filled up, but you'd love to see more people and be able to help more people.
I certainly do, and I have been seeing people that I've seen when I was previously here, and I'm very happy to see them and help them out.
I bet you those folks said, "Where did you go? Come back!" And they're probably very happy to see you.
Yes, they are.
Yeah, well, why not? After all, if people are suffering from various ailments, now we've talked about arthritis and we've talked about gout. I'm sure that there are other things that a rheumatologist such as yourself would basically find on the list of the menu of items and illnesses that you treat.
Yes, there are certainly other systemic autoimmune diseases that we deal with, and some of the diseases that we commonly deal with is scleroderma, myositis or inflammatory myopathies, Sjogren's syndrome, besides gout and rheumatoid arthritis and osteoarthritis.
Yeah, a lot of things that you can help folks with.
Certainly do.
Very good. Very good. All right, so boys and girls, make your trip to your primary care physician. If you've got that medical condition that just isn't healing itself, and the pain is getting to be a bit too much, then Dr. Ladani probably is somebody that you need to see. Thanks for coming to visit with us today.
Thanks for having me.
It's good to have you back in the area.
Well, thank you so much for having me today.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. 24 minutes after 8 o'clock. And on the way, Jake in the newsroom, CBS Sports Minute, coming up.
It's time for the Kubota Customer Appreciation Event with Walker & Walker Equipment in Indiana. If you've ever thought about buying a Kubota, there's never been a better time to purchase than now. This is the biggest sales event of the year, and it's happening right here at Walker & Walker Equipment off Route